Welcome to Physiosoft. Please sit back and enjoy this 11-minute presentation. Physiotherapist Leslie Lambie, a physio in private practice, realized that 68% of her patients came to her with computer-related repetitive strain injury. When people sit at a computer for long periods of time, their posture usually slumps. The result is extreme upper back, shoulder and neck pain, as well as headaches. Leslie would treat the patients and suggest to them that when working at their computers for long periods of time, that at regular intervals of about 50 minutes that they get up, walk around and shrug their shoulders. However, their focus on their work would be so intent, invariably they would forget, and as a result they would return to Leslie for more treatment. Wondering how to remind users to do loosening movements, Leslie came up with the idea of an animation that pops up on the screen at preset intervals, and so Physiosoft was developed. We started off with 13 movements for the upper back, neck and shoulders, and had immediate results from sufferers. However, some of these people also complained of eye strain from staring into a screen for hours on end. In fact, 82% of the respondents in a survey that we ran said that they have some form of eye strain from too much computer work. So 13 movements were researched and put into Physiosoft. Then, because of tendinitis and carpal tunnel syndrome, 11 hand movements were also added. As a result of the movement types, a user can choose either neck and shoulders, eyes, or hands, depending on the nature of the complaint. There are two versions of Physiosoft, a LAN version installed on a computer server and a CD version for the home market. We will now show you the 13 movements for the upper back, followed by the eyes, and lastly hand movements. You will see on the screen is movement 1. It tells you it's movement 1. Each movement lasts for in the region of 20 to 30 seconds, depending on the nature of the movement. We will now go to movement 2. What you can't hear is music. We've created a nice soft library music that first informs the user when Physiosoft pops up on a screen, and it also tells the user when they can stop doing the movement, because sometimes they're not facing the screen. And you can see the shape of this movement. Movement 3 is moving to the right hand side. Movement 4 will in fact be the opposite. For each movement, there is always a compensating movement to the other side. This is movement 4. I'm moving on to the next movement, which is number 5, and that is a right head rotation. Now up here where I've got the mouse pointer moving, corporate people could have their logos or their colours implanted in there to customize the program for their use. I've now moved on to movement number 7. I'm now pausing the program, and the reason why you can pause the program is imagine if a movement had just started and the telephone rang. The user may want to answer the call, but they may also want to continue with the movement, so they merely put the movement on pause until such time as they finish the call, and then they will play again, and then the movement would continue without them missing that particular movement. You can move on to next as you keep seeing that. I have now paused the program again, and I've clicked on the question mark, which brings up the help screen. I've clicked on how to stretch, and the users would read the manual before using the program. I'm now going to scroll down through the movements. You can see that this was the first movement that you saw. And there is instruction for each movement type. And I'll keep scrolling down until such time as I get this movement, this current movement 8. Of course, there is a manual for each of the movement types, that is for eyes and hands. And you can see that this is a neck flexion, and there is instruction on how to do the neck flexion. I'm now going to close the manual, and I'm going to click play again to continue with movement 8. I've now moved to eyes. This first movement is called blinking, and blinking is a wonderful way to refresh the eyes, to bring blood to the area, and to loosen up the muscles of the eyes. It removes all dust from the eyes and helps with tiredness. I've now moved to exercise 2. The eye movements have voice instruction as opposed to the movement. And the reason why is because a lot of the eye movements are either closed eyes, or you have your eyes looking away from the screen. So the voice instruction will tell you what to do at that point in time. You may have noticed I've quickly moved to exercise 3 and now 4. I've now paused, and I'm going to show you some of the other features of the program. We're going to move up to status, which means the program is can be disabled or enabled, and the sound can be turned on or off as well. Now down to the schedule, which gives the user the ability to set up the time frame when they want the next movement to pop up for themselves. For instance, if they have a chronic shoulder pain, they may drop the movement down to 30 minutes. But once the pain has alleviated from doing the programs, they can change it back up to, say, 50 minutes to suit themselves. I'll now continue with the exercise 6. Palming. Palming is a wonderful way to refresh the eyes, as the cupped, warmed hands stimulate blood flow to the eyes and relaxes the eyes. The darkness also helps with relaxation of the eyes. I'm now going to move to the hands, and we'll only do a few of these. And with the hands, there is in fact the music again, not the voice instruction. You can move back to previous, and you can move back to next, as we've shown you before. Remember, we can offer Fiziosoft in your corporate colors. There is an extra charge for that, as it does constitute programming work for us. There are 10 hand movements. And I would like to summarize Fiziosoft. But before doing so, I would like to proudly tell you that Fiziosoft won the prestigious Enablers Award for the most innovative software program of the year 2007. For further information, you're welcome to phone us or email us on the given numbers on the screen. Thank you for your time, and we look forward to helping your staff reduce their repetitive injury strain from too much computer work. Thank you, and goodbye.